Hi everyone, board certified plastic surgeon Sean Doherty from Boston. Several of my patients and viewers have asked me to speak to you about the thread procedure. The thread procedure is done in the office and it takes about a half an hour. Ideal patients are patients that are healthy, they haven't had a lot of surgery on their face, and they're bothered by a little bit of jowling here. They look in the mirror and perhaps do this and need a subtle improvement. If you're looking for a dramatic improvement, meaning there's significant hang of the lower face and neck, this procedure is not for you and I need to talk to you about surgery. Threads are best when combined with other procedures, so skin improvement procedures like needling or laser, filler for the nasolabial folds and cheeks and lips, and then also neurotoxin to improve lines around your eyes and forehead. So two different threads are done in this country. One is the polylactic acid group and the other is the PDO group. Polylactic acid is the Instalift or Silhouette lift. I tend to not do that procedure in my office. No reason that I don't feel that it's not a great procedure. I just tend to not use them that often. It has a little bit more of a downtime. It's a great procedure though for those patients who are looking for that type of procedure. The PDO threads tend to be more what I use. These are two of the groups. They come with a couple different commercial possibilities. What happens during the procedure is I numb around the ear, I make small poke holes, and then I deliver the threads through that. The threads come in a piece of metal like this. This is a blunt instrument. So once I'm numbed and I have a poke hole, this is placed underneath the skin, goes underneath, leaves the thread, this comes back up and leaves the thread in place. The thread is this. I don't know if you can see that. This is smooth in one direction and barbed in the other. This is the same material of suture that I use in the operating room, so I'm very familiar with this and patients tend to do very well with this. So this is placed underneath the skin, goes with the grain of the thread, and then pulls back against the grain, and the barbs pull on the underlayer of the skin, on the upper layer of the muscle, and that creates a subtle lift. The results last about 8 to 10 to 12 months. Here's one before and after picture. So she had subtle jowling, and she certainly improved. This is a couple of hours after the procedure, and those little poke holes are what one would expect to have for a couple of days. Now, for those of you who can handle this, here's a little video of me doing this procedure. So this patient was numbed. I have made a poke hole in front of her here. You can see the metal device going underneath her skin. This patient's had surgery before, so I had a little bit of resistance. However, you can see how that thread lays nicely there. One more is going to be placed along the jawline. This goes underneath the skin, above the muscle. She's feeling this, but it's not particularly painful. I pull the thread back and lift that skin up. You can also see where the threads are kind of hanging out there around the ear. Those get trimmed before the patient leaves. So, takes about half an hour to do the procedure, lasts about 8 to 10 to 12 months, and it's best when combined with skin treatments, filler, as well as Botox. Thanks for listening, and I hope to talk to you soon.